So, welcome back. I'd now like to introduce our keynote speaker. He is Massimiliano Mascherini, who's interim head of unit for social policies at Eurofound, having worked there since 2009 and have previously worked at the Joint Research Centre of the European Commission. He studied at the University of Florence and has a PhD in applied statistics as well. And he's been a visiting fellow at the University of Sydney, at the University of Aalborg, and is a visiting professor at the Pontifical Academy of Social Sciences. Just before I give the floor to Massimiliano, a word about Eurofound is the EU agency for improvement of living and working conditions with its headquarters in Ireland. ESPON is especially pleased to invite Eurofound to this seminar because of the obvious proximity in our missions to bridge research and policy making, and because living conditions and quality of life is one of the main activities in Eurofound's work program for the 2021 to 2024 work period. And as it's impacted our event here, but generally in terms of quality of life more widely, the COVID-19 pandemic and the economic impact that that has had and the impact of that on the quality of life. So therefore, without any further ado, I'd like to give the floor to Massimiliano to give his first insights into the impact of COVID on people's living conditions. His keynote is entitled, "The Impacts of COVID on Living Conditions and the Quality of Life in Rural and Urban Areas." So Massimiliano, the virtual floor is yours.
Thanks a lot, and good morning from Dublin. Thanks for the nice introduction, and it's absolutely a pleasure to contribute to this event. As you mentioned, our mandate is similar, is approaching and research is to do research and try to do it in a way that we can reach our policymakers and we can produce evidence that is useful for their work. Therefore, for this morning, I have prepared a presentation that will investigate, that will show the impact of COVID-19 between the difference in the impact between the urban and the rural areas, and have done that through our survey that we carried out during the pandemic, and we're unfortunately still carrying out because the pandemic is not finished. So, without further ado, I will start with the presentation. So, very good. So the COVID-19 started in March 2020 as an health crisis. We all have quite vivid in our mind the images of the health crisis reaching Italy as first country with the horrible images from Bergamo. But then it reached all the other countries, and in an attempt of protecting the societies from the virus, governments worldwide put in place lockdown and restriction, the so-called non-pharmaceutical interventions, actually, that basically developed quickly in an economic and social crisis, whose effect actually may linger long after the pandemic has finished. The crisis actually, as we see the crisis in some countries, it's like a modern Kerberos, you know, the guardian of the hate, this three-headed hound that was there, and basically we have one head for each crisis: the health, the social and economic crisis, but is an overall beast actually. And this overall beast and these three different heads affected groups of citizens and territories differently. In terms of virus, actually, and in terms of disease, we know actually that older people was unfortunately much more vulnerable to the lethal consequences of the COVID-19 disease. However, they appeared then more resilient in terms of economic and social implications of COVID-19. On the other hand, the younger cohorts, and with the younger cohorts, we mean everyone age 50, younger than 50 actually, so younger in comparison to the older workers, they were more resilient to the lethal implication of the virus, but they were definitely more vulnerable to the economic and social implication of the pandemic. So we have really this polarization of the different effects. So we can move on, please. and then this effect is not just among a group of citizens actually, but also among territories. The crisis affected a group of territories differently actually, and the rural and the urban areas were differently affected. And also how the crisis developed across time. There is no doubt actually that at the beginning this crisis was an urban crisis, it was a crisis of the city. Urban areas were hit first by the negative effect of the pandemic, both economically and both from a health point of view and also an economic point of view. However, they also promptly reacted by taking precautions aimed at preventing the spread of coronavirus. Rural areas actually had, on the other hand, according to the literature, quite a different picture actually. Given the lower density of the population, the virus penetrated more slowly actually, but in some cases they were also they were less prepared and adopted fewer measures to contain the virus. Next slide, please. So while at the beginning we thought actually, or OECD in this case thought that rural areas could have been spread actually. Then in August 2020, it was the case that we realized that this was not the case. Simply they were reached after the cities in terms of COVID rates. And so mortality raised in the second part of the crisis. So in that is basically the second wave of the crisis, and this created quite a lot of problems, unfortunately, because it was found that residents had rural residents actually have a higher prevalence of the pre-existing conditions, which put them at greater risk of COVID-19 implications. Rural hospitals were less able to handle an influx of COVID-19 patients because they tended to have less specialists and probably less technology and capacity in terms of the ICU beds. And then, as a result of this, actually, we know that from an economic and an industrial perspective, urban and rural areas are different. So the crisis penetrated in the second part of the 2020. It reached rural areas, both from an health perspective and an economic and social perspective. Now, in order to investigate the impact of the crisis, what we did at Eurofound in March 2020 was to launch a survey, Living, Working, and COVID-19 survey. We have been also with some pride, actually, we can say that we have been the first European organization in launching a pan-European survey that covers all the member states and allowed to understand the impact of the crisis. We feel that in March 2020, actually, and with a glorious effort, actually, in order to capture the first impact of the pandemic, we thought that this would have been, the first and only survey, because we were hoping, as everyone, that the crisis would have disappeared in a matter of few weeks. We have now concluded the fourth round of the survey, and we are going to have another fifth round in March 2022. So we can see the development of the crisis among citizens with at least 5 points in time. So what I'm going to present you now is basically, and thanks for moving the slides, is basically the results of this survey. So first, let's start with the labor market, the impact of employment. As we can see for the graph, with the green are rural areas and blue are urban areas. In the three wave of the slides run in spring 2020, summer 2020, and then spring 2021, we can see that at the beginning, in terms of job lost, urban areas were those hit the most. Actually, in spring 2020, at the beginning of the crisis, the rates of job lost was more or less the same between rural and urban areas. Then, in summer 2020, there were a prevalence of job lost in cities, but then 6 months after, in spring of 2021, the situation was reversed. As I was saying before, the crisis arrived to rural territories, and so the number of job lost is higher in rural areas than it is in urban areas. If we move on in this, we know that what the pandemic has brought in terms of labor market is basically the surge of working from home or telework, smart working. These are new words that enter in our dictionary. Each member state adopted its own. Actually, here in Ireland is working from home, in Italy smart working. But anyway, it means that a large part of the population started to work from home. Of course, in those sectors where this was possible. These actually data that is shown here in the picture represents the share of the population that was working from home, from the work from home only, from the workplace only, or combined, so both workplace and home in an hybrid situation in rural and urban areas. What we can see actually here is that there is the increase of share of the population that were working from home only actually concerned mainly the cities. Both in spring 2021 and in summer 2020, we can see that the share of those that are working from home only is much higher in the cities than in the rural areas. And on the other hand, it is clearly higher, I mean, almost double the share of those that work from the workplace only in rural areas. Is more than 60% in spring 2021 were the employees that worked only from the workplace against the 43-45% of those working from home. So clearly there is the remote working, yes, but this is a phenomenon that concerns most of the city. The reason of that this is happening, of course, and we can move to the next slide, is because the distribution of jobs in the different sectors is clearly different between rural areas and urban areas. This is according to our survey. Actually, the respondent claimed to work in these sectors, and as we can see, actually here there is a higher incidence in the most teleworkable services, notably education, financial, and public services in urban areas than in rural areas. On the other hand, there is a prevalence of rural areas in those that are non-teleworkable sectors like commerce and hospitality, for example, constructions and industries, and especially agriculture. So this is also the reason why the surge of telework was mainly in the cities. Now, if we move on, actually, we know that what telework brought actually was from one side to save a lot of jobs actually, but from the other side, together with the closure of schools, this put a lot of strain under women's shoulder because, especially in the first round of the crisis, they found themselves to have to work from home, as well as to provide support to their own children in terms of education. So this was really let's say a deadly combination, in the sense that really the work-life balance of women exploded much more than men, as in a kind of duos to the unequal distribution of family responsibility. What we see actually from our data, and I'm not sure this is quite clear from this graph, of which actually I think there has been reverted the green and the blue in the second part of the graph, is that the difference between men and women was large, and these work-life conflicts exploded more in the cities than in the rural areas. Now, if we move to the next one, actually, I spoke about the impact of education on work-life balance. However, the impact of education is an important item per se. Probably we all remember in the first, I mean, those who have children, of course, that when the pandemic exploded and the child and children suddenly had to work from home, we thought, okay, go to Netflix, play PlayStation. I mean, we were try to find something that was an alternative to them. Was not very easy actually, we did our best to provide the support to them for education and so on. And probably we did our best to increase the transfer of human capital to them actually and support the school one. However, school has a very deep effect on children, especially in human capital accumulation as well as in the psychosocial development of children. So, despite our effort, of course, there will be on children a short and a long-term effect of closure of schools. It is important to reflect, and I'm going to do now some general considerations. Actually, and I will focus on the urban-rural divide because the effect on children has been very different depending on childs actually, and all these effects will have implications on lifelong actually. We know that those kids that were older, I mean, they were at the end of their educational trajectory. The closure of schools basically meant to arrive to the labor market or to the university with a kind of an unfinished accumulation of human capital because the last part of the programs were done differently than previously. On the other hand, on the younger kids, age 6, for example, that were learning to write, this impact might also be profound because if you accumulate, if you have a disruption and the very early stage of education, there is the risk that you will bring death over the course of life. And there are studies that shows that, for example, it was projected that 1 year of school closures in the United States may correspond to an increase of school dropout of 17%, as well as a decrease of 7% of young people enrolled in college over the next years. And most importantly, it also could have a lifelong impact on earnings of 1 or 2%, because the kids that have suffered the disclosure of schools, actually, although with some variation, will be a generation with a lower level of human capital in comparison to the previous and to the following generation. So this is quite important that we act in order to try to fix the disruption that has happened in terms of human capital. So, sorry for this introduction, but I think that it's quite important to reflect on the long-term implications of school closure. Now, if we move to rural and urban, actually, if you can come back, please. Will you please come back to the view slides? Thank you. If we see the results in terms of urban-rural district, actually, we see that a study conducted by the RAND Corporation show that there has been quite a different approach actually. In February 2021, actually, only 17% of urban districts were offering a fully in-person education compared to the 42% of rural districts. So basically, online schooling were more present in urban areas than in rural areas, actually. And however, despite being less present, actually, rural district leaders declared that they were at a higher level of support for in-person instructions, both among teachers and parents. in comparison to the others. Now, we surveyed these with our survey, and could you please move to the next slide? And what we saw actually that the results of the RAND study were mirrored here. So what we see is that there is actually a kind of similarities in the results. First of all, there were more or less half of the population that had online schooling among students would like to have more online schooling in the future, a little bit less than half of it. And I think that it is okay to sign that things didn't go well, but not even terribly wrong, but of course depend on the situation and on the districts. But people from urban areas were more satisfied with online schooling in comparison to those in the rural areas. This is quite a large difference of 12 points. So there has been also a different effect in online schooling in terms of urban and rural divides. Now, what is interesting, in order to move on if we can move on actually in the next, what is also interesting actually now, we have looked at the impact on employment, we have looked at the impact on education. And now let's look at the impact on living condition of people actually. You know that the crisis arrived and basically it hit all the population very hard. Thanks to the strong policy responses at the European level, which supported and provided a stronger social protection, a lot of people received unemployment benefits or ended up in a short-time working scheme that allowed to save their job. However, of course, there were an impact of this in the capacity of earning of individuals, especially among those who lost their job, as well as those who unfortunately had to rely in benefits. So we investigated the living conditions and financial situation of peoples actually, and we saw that a higher share of people in rural areas reported that they were finding difficult to make ends meet, and this happened in all the round of the surveys. I think there is a phenomenon that we know, but it was strengthened during the crisis. And since April 2020, so the longer is the crisis, the larger has become the gap in the share of people that are at risk of that they find it difficult to make ends between rural and urban areas. So in some member states, these are very real issues. I mean, in some of the Eastern European countries, these can be a problem together with some South Mediterranean member states. Now, if we move on, actually, we can see some numbers on this. And basically what we see is that you can see that from the graph that the gap between rural and urban areas increased over time. So the person in spring 2021, actually, the percentage of people living in rural areas having difficulties in making ends meet actually was almost 7% higher in comparison to those of the urban areas, against the 4.8% of April 2020. So there has been a constant increase. If we move on actually, and we go more in depth on this, we can see where is the problem. I mean, if people has problems to find the difficulties to make ends meet, where they found more problematic, so where they may have areas actually in paying the bill. What we found was, and not surprisingly, is that a higher percentage of respondents living in rural areas reported being in arrears in comparison to those in urban areas. You can see actually that this is reflected in all the items, in healthcare and health insurance, in formal loans, phone and utility bill, consumer loan, but especially utility bills. In utility bills, the gap between urban and rural areas is pretty high, is almost 5% actually. So here is really where there is more difference among urban and rural. Actually, if we can move to the next slide, actually. Now we have seen also the impact on financial fragility and the risk of poverty. Now, before concluding, I wanted to discuss a bit the social capital side and the mental well-being side. Let's start with the mental well-being, actually. And there is no doubt now in literature that using the words that I used at the beginning, that together with the pandemic, there is an epidemic of mental well-being issues, actually. And with the crisis, we had a surge of mental well-being issue, with a large part of the population that felt depressed, that felt lonely, and particularly tense. Here there is an interesting phenomenon that I wanted to report, and is the following. During springs, rural areas perform in these indicators much worse than urban areas in all the three indicators. During the summer is the opposite. There is in the cities, there people feel more lonely, more tense, and depressed actually. And of course, I think that here the summer and living open air actually can play quite a good role. But this is an interesting aspect that we found that was quite unexpected. Now, as I have to go to conclude, if we move to the next slides, let's talk about optimism actually. And here we see that in general, urban areas has a higher level of optimism than rural areas. The dynamics remained the same. I mean, in spring 2020, it was low in comparison to the crisis. It increased in summer when society were reopening and we were hope actually to restart to live as we were. In spring 2021, with the turnaround, it reached the lowest level. So this is the trend, but the difference between rural and rural was confirmed across all the 3 years. Now, if you move on, actually, this was I decided that probably it was good to have one slide on vaccine attitudes. Here, the perception of vaccine attitudes, according to our survey in March, is pretty different. On average, actually, in urban areas, 76% of the people stated that were likely, very likely, or rather likely to take COVID-19 vaccine. Actually, as soon as it became available to them, the share in rural areas was quite lower. It was 10% lower, only 60%. Why is that? Actually, well, in scientific literature, there is a nice correlation. There is an interesting correlation between trust in institutions and vaccine hesitancy. And if we move to the next slides, we will see actually these urban areas has a higher level of trust in all institutions. That can be country governments, the European Union, the healthcare system, and so on. The only item where the distance between urban and rural areas in trust items is police, where the shoe values between rural and urban is more or less similar, and also trust in social media, where the shoe rates are quite similar. And actually, especially the last one is a bit concerning actually. Now, if you go a little bit more in depth with the country government, we saw this trend that was common among rural and urban areas. We had a rally around the flag in spring 2020 when the COVID arrived, and then the trust in government actually decreased both at the rural and urban level. If we go to the next slide, we will see the trust in the European Union, on the other hand, as a different trend. It was pretty low actually in spring 2020 when the European Union was struggling to find a common answer to the crisis, and a lot of Europeans suffered this lack of solidarity that emerged from the words of some prime ministers. Then, with the decision of the European Council of July 2020 of the launch of the Next Generation EU and the Resilience and Recovery Funds, actually, the trust in the European Union surged actually again, and then it decreased again in spring 2020 after 12 months of COVID. Now, the next slide to conclude. People living in rural areas has been particularly exposed to social economic insecurities. As we have seen, the crisis first hit the cities and then moved to rural, and that probably the effect on rural was more deep than the one in the cities, at least now. The rural areas are characterized by less sectoral diversification and less developed digital infrastructure. So this is a very important point, because the shift to telework was more difficult to implement than in urban areas, and especially, if we read as we read actually now that as a result of working from home, a lot of people will move to rural areas in order to working from there. This can be true, but digital infrastructure and high-level services are needed in order to make this happen. So as a result of this, I started at the beginning saying that the COVID-19 crisis was a modern Cerberus, the three-headed hound, guardian of the hate, because the crisis is basically economic, social, and a health crisis. So what we need now is basically a modern Heracles. So basically, like the Greek hero that defeated Sir Cerberus, and how he did it, he basically took him from his throat by taking an holistic approach that defeated all the three heads at the same time. And this is what we need, an holistic approach that can address the not equal impact of the economic, social, and the economic crisis among social demographic groups and among territories. And thanks a lot for your attention. I'm happy if there are some questions.
Right, excellent. Thank you very much indeed, Massimiliano, for a very interesting introduction there. For me, from the point of view here from moderating the event, I'm very interested in some of those dynamics. It would seem to me, is it fair to say that already existing differences or tensions between urban and rural areas have then generally been made more severe throughout this crisis? Some of the things you've highlighted there, for example, a concern about payment of utility bills, for example, or issues to do with urban connectivity and internet connections. Those are surely issues which actually predate the COVID pandemic and have been brought more into view as a result of the pandemic. Is that fair?
Absolutely. What the pandemic has done actually is to exacerbate existing inequalities. And so this gap that you mentioned in infrastructure as well as in living conditions, as I have shown in my slides, has been definitely exacerbated during the pandemic. Pandemic also in history are being observed as events that really exacerbate inequalities, that bring to surface and already in new inequalities, but especially existing inequalities. Here, we have different groups of the population that has been hit differently. I mean, if I spoke about young people, for example, young people is a group of people that has been hit very, very hard actually, because they have lost their job more than older workers. They basically have suffered the effect of lockdowns much more in terms of mental health than older workers. Among the same group, there could be actually people that were working in sectors that went to work from telework, and so they had an increased earning capacity, for example, or increased saving capacity because they didn't spend, but they didn't have fluctuations in their earnings. On the other hand, those who lost their job actually may have actually had to rely on savings, and then the difference within this group has increased in terms of wealth, for example. These happen in some sense also in terms of territories, actually, and those territories that are lagging a bit behind. And we know, for example, from other studies that the south of the south or the east of the east, the rural areas in the south of the member of Europe or the east of the east, are those that they may have suffered more because lagging behind in terms of infrastructure. And these actually, this problem emerged during the pandemic when we had to rely especially on digital infrastructure.
So, building on that, we have a question which comes in on Slido from someone tuning in online about the future impact of teleworking. Now, I'm aware this is perhaps a challenge to basically using the data looking back to try to extrapolate that forward, but is teleworking likely to support the recovery of the job market, or is teleworking going to just essentially continue to accentuate the inequalities of the job market looking towards the future? And that was particularly posed in the concept of women's position in the labor market. So you didn't have that in your slides, but for example, is there a gender difference between the use of teleworking as well? Perhaps you might say something about that, about what permanent changes maybe teleworking may bring, and whether that will accentuate or whether that will reduce inequalities in the job market.
Yes, thanks a lot. It's a very interesting question, actually. And there is a lot to say, actually, and probably not uniformity of views. First of all, women, yes, women are those who telework more. If you look at the past, were those who were teleworking more, that have teleworked more, and they express the wish of teleworking more. Because with the telework or working from home, sometimes it's easier to accommodate family responsibilities, actually. And so this enhanced flexibility would be welcome to women, actually, in this. This is definitely true, but then what is the long-term implications of this? I mean, and this is quite important. Probably we should reflect about that in the sense, the thing that we should avoid actually is to have segregation. To have a part of the population that are more likely to be women that do not show up often in offices, and so they become to be less visible, to have a lower prospect of career because simply they are not in the office, actually. So that is a thing that we really need to address in order to avoid that gender equalities are exacerbated by this new style of working that can be working from home. This for sure, we need rules and we need regulation in order to prevent this to happen, but as well as to give the people the right to disconnect. I mean, working from home does not imply that we are always available, although actually the last 12 months often happen that we are always available, actually. But this needs to be regulated. We have to provide the right to disconnect to people. So legislative action is very important here, both in support of women, but also the minorities. Now, it's a tool for the recovery, or it will increase inequalities? That's very difficult to answer. For sure, we are in front of a kind of revolution. Telework is here to stay, it's not here to disappear. The concept of work has changed, and the pandemic has accelerated this change with a dramatic speed, actually, and we will never come back to how we were before, this for sure. We talk about now digital nomads that will work from everywhere, and I mentioned actually in my presentation this idea that people could, that people want and willing to move to rural areas, because maybe we are going to an hybrid form of work where we have to show up in the office only a couple of days a week, and so we can afford a longer commuting time from the countryside to the cities, because this will be just 2 days a week and not every day. So there is a lot of dynamics that can start, and so this can be a tool that could help the recovery. However, if you want to make really this an opportunity for moving out from the cities and basically to strengthen rural areas, of course we need to fight inequalities on this. I mean, we need to provide investment on digital infrastructure, but also on services. Because if we want to avoid that this new style will concern only a very tiny minority of the population of employees, but is also open to families, we need also to provide high quality services in the rural areas, for example, in terms of education, high quality schools that can be attractive to families in their decision to relocate then in suburban or rural areas, and therefore to relaunch also this area and to fully exploit this opportunity that telework can give.
That's actually a question which has also come in the chat. Is there a changing perception about remote places, and can these become viable alternatives to urban life? So I think you've in part answered that as well. But are there any other things which would have to happen in order for that change to come? Or alternatively, do you think that those discussions which have been had in the media about people kind of moving out into the country as a result of COVID, do you think that actually that impact has been overestimated in the media debate? Our newspapers are full of interviews with people that have done precisely that, but how significant is this effect? And do we have any idea about that so far?
I don't have any data about that.
Right.
I don't have any data about that, not yet. There is this effect for sure, but I think that is what is crucial is that this goes hand in hand with the development of a digital infrastructure and of services that can be put in place, can be replaced, can be enhanced, of good quality in rural areas, and this will make them actually inevitably attractive. I will make actually an example. An area of the United States actually was a normal village, was quite remote. I think it was in Colorado. I think it was Boulder, and for some reasons, actually, there was the presence of an university, I believe. It started to become a strange attractor for a lot of people working in the Silicon Valley. So we are talking about a privileged minority that relocated from Silicon Valley to this place in Colorado. What happened was that services followed them, and they started to implement high-level services because there were these niche of very skilled workers in this area. So, at some point, are the two things that work together. I mean, we have to start to develop digital and high quality services in these rural areas to make them more attractive to people. People will arrive, and then private investment will follow, and so on. But sure, we have to equip them with the right tools and with the right services in order to make them attractive. Besides, for the moment, I think that would be quite limited or restricted, but it can broaden.
Could I we're almost out of time, so I'm just going to pose one final question that came in from Slido, and then we'll draw it to a close. It's about the the psychological impact or the kind of how people's mood through the corona pandemic. You spoke in your slides about a difference of an impact during summertime, for example, in rural areas. To what extent is this kind of health or well-being issue driving this change here? And is there anything, if we were to take that kind of well-being effect of quality of life, that you can draw from the work that you've done so far? So I'll pose that as the final question, and we'll then draw this session to a close.
Yes, well, I'm not sure if I got completely your question actually, but what I show in my session, in my slides, is that in terms of mental well-being, actually, there has been a different impact between the winter and between the summer. Let's say that what makes really the difference in lockdowns is, for example, quality of housing. Staying in not decent housing or be actually restricted from movement by staying in big buildings like in the cities was found to be very detrimental from one side and very dangerous in terms of COVID spread actually. I think that on the other hand, in the rural areas where there are more sparse population, during the winter, this can give actually a kind of a sense of isolation when we were all included. All contained and restricted in our houses. I would say that during the summer, meteorological and weather played his own role actually. People from the cities, yes, was free to go actually because we had the reopening of the society, but going actually where from a building to another one, but on the other hand, in rural areas actually, people could really enjoy the open air actually, and so breathing outside our lockdowns. So I think that that phenomenon was very interesting for us, and we wanted to investigate this more in order to understand better the dynamic, because this change was quite striking actually.
Right, excellent. So thank you very much indeed, Massimiliano. So a kind of virtual round of applause for you. Thank you very much indeed for joining us this morning. Some very interesting insights there. And I'm sure also the debate will carry on online in light of that keynote. Thank you very much indeed for your intervention.